Welcome to everybody. I'm delighted that you've been able to attend the Altered Lives in a Time of Crisis launch from the TILDA working group at Trinity College. COVID-19 has altered all of our lives, but its impact on the older population has been especially acute. Not only is mortality associated with the disease much greater amongst older cohorts, but the restrictions put in place to curtail the spread of the virus have disproportionately affected this group. Many have been denied access to family and to social networks, and those over 70 in particular have been advised to stay at home or cocoon in their homes, and they are often alone in this context. The briefest look at some of the headline findings confirms how profoundly lives were altered. 2/3 had not at all gone to visit the family since lockdown, and you'll hear more about this as our researchers present later on. 4 in 5 had not at all visited friends. Many delayed accessing medical care, and this is a worrying statistic which will significantly have knock-on effects on the health service. Over half of those who delayed visiting a GP did so out of fear. Clinically significant depressive symptoms were twice that which they were in the wave just prior to the collection of this COVID data. 1 in 20 of our participants had lost a friend or a relative due to COVID. I won't speak too much more about the findings because you'll hear these in the subsequent presentations, but suffice to say that the findings suggest that the impact of the pandemic will persist well beyond our achieving herd immunity. And I hope it doesn't sound too pessimistic a note, but the majority of these data come back to us when only the first wave of the virus had hit. And we're now in the third, which is in many ways been even much worse, we know. In any event, the data preserve a record for the first important findings with respect to the impact of COVID on this particular cohort. And we will make these data available for public later on in 2021. It's often said that journalism is the first draft of history. When posterity comes to assess this particular period in our lives and how it affected us as a country and as a society, they will look to how it was reported, debated in official records, tweeted. One thing they will see recur in public discourse is the claim that older people's voices have not adequately been heard. This particular TILDA project goes some way to address that because we offered our participants an opportunity to give us free text, opinions, feelings, reviews of their experience of COVID, and the substance of those free text reports will be made available to you in our next wave of this data iteration. The Department of Health has been one of our partners on the project, and I want to acknowledge them and our collaborators, national and international, from academia and from NGOs. Many of them have joined us here today, and we hope that you get some value and worth from this data that you can use in your own day-to-day practices. I want to thank Dr. Mark Ward. Dr. Mark Ward is a senior research fellow in TILDA, leading the project very ably and has particularly led this COVID TILDA report, and you'll hear from Mark next. We have 2 other speakers who you'll hear from this morning or this afternoon, Celine and Georgia Layler. But behind the scenes, to get this data available to you rapidly, properly analyzed in an interpretable manner, there have been a fantastic team, and I want to name them by name. Anna Davies, Keith Brennan, Tara Nesbitt, Ken Organ, managed all ably by Niamh Clark. And then to get the product ready in terms of the report, Sinead McLaughlin, Maria Gillen, Raji Ray, Siobhan Scarlett, Shawari Apte, Mary O'Shea, and Niall Costello. We wouldn't have the report without their collective efforts, and again, led by and supervised by Paul O'Mahony. Now we've done a number of TILDA reports, and I would urge you to go to our website to review those reports. As the pandemic evolved, we repurposed everything we did in TILDA to meet the demands of the pandemic, so that we could work closer with our policymakers to better understand the impact of the pandemic. This is the first report which actually has taken data during the pandemic, and we had lots of data just prior to the pandemic that we can make comparisons with. That's what's so valuable about this particular report. I particularly want to thank Minister Fian for launching the report today. As Minister with responsibility for public health and well-being in the Department of Health, I know that the findings and what we can learn from them will have particular resonance and relevance to the Minister and his department. And I appreciate very much himself making himself available, because this very report has widespread resonance for a significant majority of adults in Ireland. And finally, as well as acknowledging our funders, the Health Research Board, who stepped up to the mark with a rapid response funding scheme, which was hugely helpful to those of us in the research field to rapidly be able to repurpose what we were doing in order to accommodate policy and practice and research in this terribly important time. I would also like to thank the Department of Health, who sponsored that, and Atlantic Philanthropies and Irish Life, who support our study. And finally, before I hand over to Minister Fian, I want to acknowledge our participants, our amazing, wonderful participants who have been giving to this study and giving to society in Ireland for the last 12 years. They have dedicated so much time to ensure that our policymakers, that our researchers and our international collaborators have a much better understanding of the process of aging in Ireland, so that we really can, even in the context of all this terribleness that we've lived through, make Ireland ultimately the best place in the world to grow old. On that note, I hand you over to Minister Fian.
Well, thank you, Professor Anne Rhodes, and ladies and gentlemen, and thank you very much for inviting me to launch this very important report on the impact of COVID-19 on Ireland's older population. As Minister for State at the Department of Health with responsibility for public health, well-being and the National Drug Strategy, I am acutely aware of the negative impact that COVID-19 has had and continues to have on older people in Ireland. Older people in nursing homes have been particularly hard hit in terms of infection, mortality, and reduced contact with family and friends. Older people living at home have experienced loneliness and isolation, as many have had to cocoon to protect themselves from the virus, and this has been particularly hard for those living alone. The evidence provided in this report, in particular, valuable as TILDA researchers have been able to compare the findings from this COVID-19 study with the circumstances of older people before the advent of the pandemic. Much of the value of TILDA lies in its longitudinal nature, in the ability to compare the changing health, social and economic circumstances of a representative sample of our older population over time. Looking ahead, we will be able to gauge any lasting impacts of COVID-19 on our older population's health and well-being. Some of the findings in this report aren't unexpected in that they confirm what we already knew or expected, but the report provides important new evidence on the extent of the impact of COVID-19 on older people. The next three speakers are going to present the findings of the study in some detail, so I won't dwell on all the issues identified by the report. However, I was particularly struck by a number of key findings which demonstrate how the pandemic has affected the health and well-being of older people in Ireland, in particular their mental and emotional health. The proportion of older people who feel lonely at least some of the time during the pandemic has more than doubled to 30% compared to 2018, when Wave 5 TILDA data were collected. The proportion of older people who report potentially clinically meaningful levels of depressive symptoms has also doubled. The proportion of older people who have taken on a caring role during COVID-19 has doubled to 15%. Almost 1/3 of adults aged 60 and over delayed or did not get medical care they needed during the study period. On a more positive note, almost half of older people availed of a telephone or online appointment with a GP, and the proportion of TILDA participants taking vitamin D supplements has more than doubled. However, overall, the COVID-19 studies findings make for stark reading. The government is acutely aware of the negative impact COVID-19 has on all our lives, but in particular for those most at risk, older people and those with underlying conditions. Work is ongoing on multiple fronts to try to limit these negative impacts. Specific guidance for the over 70s and medically vulnerable has been provided by the Health Protection Surveillance Centre and is available through their website. This guidance has also been supported through public health information campaigns such as In This Together campaign and through information networks including key organisations working with vulnerable people. The Department of Health is working with the HSE and not-for-profit organisations to provide the maximum possible level of social care services and support to those who need them through face-to-face delivery and, where this is not possible, through virtual supports. In October, we launched the Keep Well campaign, which is aimed at supporting our citizens through the difficult winter months. The campaign encourages us all to do something that is good for us each day or week, like going for a walk, connecting safely with friends or family, engaging in a hobby, or reaching out for the support that we may need. By doing so, we will create balance, routine, and resilience. Specific supports have been provided aimed at encouraging older people and adults to be more physically active. I want to mention you to a series of online videos called Minding Your Wellbeing, recently launched by the HSE, which provides an opportunity for people to learn more about key elements of mental well-being such as mindfulness, gratitude, self-care, and resilience. Isolation of people of all ages is a significant risk during the COVID pandemic, particularly during periods of tight restrictions on movement and social interaction. The Community Call Programme was introduced in spring last year to provide helplines and through local authorities for practical support, information sharing, and befriending. The immediate focus was on the elderly and the most vulnerable, and mobilising rapid response in every county to make sure everyone is looked after. As part of the Keep Well campaign, the Community Call Programme has been significantly expanded to improve the well-being of our society, with a particular focus on outreach to those who are potentially isolated. Our clear message is that whatever people are going through in terms of reduced social contacts or in isolation, we should all stay as connected and as healthy as possible, helping to strengthen community and individual resilience, restoring hope that we can and will recover and make it through this together. The COVID-19 vaccine is currently being rolled out. Our strategy prioritised those over the age of 65 living in long-term care facilities, frontline healthcare workers who are in direct patient contact, and those over 70 and over. Vaccination is a hugely effective intervention for saving lives and promoting good health. The rollout of the vaccine is a beacon of hope after a very, very difficult year. Looking to the future in order to provide better care and support in the home for our older citizens, the government is committed to establishing a new statutory scheme for the financing and regulation of home support services, which is currently being developed. The new scheme aims to ensure that everyone has equal access to home support on an affordable basis in accordance with their assessed care needs. We are also committed to updating the National Care Strategy and have secured €2 million in additional funding in Budget 2021 to improve access to support for carers across the country. I would like to conclude by thanking the Health Research Board for providing the funding to make this study possible. I would like to thank Professor Roseanne Kenny, her team, and the co-authors of the study for the work they've put into conducting and presenting the results of this study. I would also like to acknowledge the range of reports already published by the TILDA team in relation to COVID-19 that have provided crucial evidence to inform the pandemic's response this year. The Department of Health is very supportive of the work being done by TILDA, and the valuable evidence in this report demonstrates the benefit of having a nationally representative longitudinal study on ageing. The work you do to make Ireland a better place for older people to live is very, very appreciative. Thank you for inviting me, and I hope you find great value in this report.
Thank you for those kind words, Minister. It's always encouraging to have the support of the department and the ministers in there. And I know TILDA works very closely with the Department of Health and the Health Service Executive, and that's always kind of rewarding for us to see our research put into action. So thank you for taking the time out from your day. And I know the Minister has to leave for another meeting, so we'll say thank you and goodbye. So hello everybody, and thank you all for taking time out to attend today. My name is Mark Ward, and I am a researcher with TILDA. So as already said, I'd like to thank the Minister and the Department of Health for engaging with TILDA research, and also to say thank you to Professor Roseanne Kenny for her kind words at the beginning, and also for really clearly communicating how important this type of work is during this time as we try to understand the impact of the COVID-19 pandemic on older adults and indeed everyone else in the population. So I am going to give you a brief overview of our COVID-19 study and tell you about some of the findings, and my talk will be followed by two of the other authors of the report, Celine and Georgia Laller from the Department of Health, and they will discuss some of their findings in more detail. So firstly, for those of you who may not be familiar with TILDA, I'm going to briefly describe the wider study and the work that we do there. And then after that, I'll talk you through the COVID-19 study and the report that we've launched today. So the Irish Longitudinal Study on Aging, or TILDA for short, is a large nationally representative study of older adults that essentially seeks to understand what it's like to age in Ireland. So TILDA started out 12 years ago with a recruitment of over 8,000 people aged 50 years and older. And at the time, this represented almost 1 in every 150 adults in Ireland. So TILDA is a longitudinal study. So that means that we return to the same participants every 2 years to conduct interviews, and participants also undergo a full health assessment every 4 years. So you can see here from the range of topics that participants provide information on. So everything from their health to household income, information on their social lives and relationships. So given the wealth of data already collected by TILDA over a number of years, I think we were ideally placed really to figure out how exactly the pandemic has changed people's lives, and importantly, how the changes people have had to make to their lives have affected their health and well-being. So as Professor Kenny mentioned at the beginning, when the pandemic reached Ireland in March 2020, TILDA immediately refocused its efforts to use the information we already had in an effort to inform the initial policy responses. And this early work resulted in the publication of a number of research reports on topics relevant to COVID-19. So some examples of these reports included the demographic and risk profiles of older adults, the use of vitamin D supplements and vitamin D levels in the population, detailed report on loneliness, technology and internet usage, which of course became all the more important as people moved online to maintain the relationships, and also data on nursing homes. And all these reports are available on the TILDA website, and I'll provide some links to these at the end of my talk. So in May 2020, we secured funding from the Health Research Board as part of their rapid response to the pandemic. And this allowed us to survey our participants with a view to finding out how the pandemic was affecting their lives. So to do this, we sent self-completion questionnaires to participants in their homes, which they then returned to us by prepaid post once completed. So data collection took place from July to November, and pretty amazingly, given the upheaval to everyone's lives at that time, almost 4,000 participants completed the survey questionnaires and returned them to us. So before presenting some of the findings in the report, I think that was a good time to bring attention to the fact that the data you're about to see here was collected very early on in the pandemic. And at that time, I think it's fair to say that no one, believed that we would still be in the situation we're in now as we approach the 1-year anniversary. So our suspicion would be that the impact of the pandemic will have changed somewhat since those early months. And to try and capture this, we're going to go back to these same participants this year and collect some of the same information, and hopefully that will help us kind of gauge how things have shifted over the last 12 months. So like the larger TILDA study, this COVID-19 study collected a really wide range of information, and today's report, or today's presentations, I should say, touches on only some of these. So specifically, the report describes changes that people have made to their everyday activities, the levels of concern about the virus among older adults, and also their exposure to the virus in the early months, symptomology, and mortality. We have a detailed chapter on loneliness, which I'll talk at some length in a few minutes. We looked at physical activity and sedentary behaviors and people's mental health. We also looked at the use of healthcare and things like unmet need. As we know, a lot of non-COVID related health services were postponed in the early months. We also look at medication use and the use of health supplements. And finally, we also look at changes to the caregiving roles of older adults, which again has been quite dramatic. So firstly, just some brief information on the characteristics of the participants. And this is really just so that we all know who exactly it is we're talking about. So the average age of participants in the study was 71 years. And in this report, we focus on participants aged 60 and older. And of these, just over 1/4 lived alone. And as we'll see throughout this session, in many ways, these have been the most impacted, certainly in terms of their mental health over the course of the pandemic. And finally, almost half, or 44% of participants lived in rural areas. So firstly then, in terms of exposure to the COVID-19 virus, so Dr. Aisling O'Halloran here in TILDA found that in terms of the levels of concern about the virus, the over 70s and people living alone were the most worried about COVID-19. 5% of our participants in those early months had a confirmed or suspected infection, and a further 5% reported the loss of a family member or friend due to COVID-19. So of course, these numbers are likely to be far higher now. And again, this is something that we will capture later in the year. So looking at people's caring roles, so previous research done by Dr. Christine McGarrigle at TILDA has shown that older adults provide a lot of informal care. And this includes things like caring for family members and caring for grandchildren. And since the pandemic has begun, we've seen an increase in the number of older adults providing regular care, and also changes in the nature of the care that they provide. So during the pandemic, 15% of older adults report caring for someone, and this compares to only 6% in 2018 when we last collected data. So this is more than double, indeed almost triple the amount of older adults providing regular care. The average age of carers was 70 years. 1/4 of carers provide care for more than 50 hours per week. So you can think of that pretty much as a full-time basis. Of those who took on new caring responsibilities or roles since the beginning of the pandemic, we find that their mental health has suffered as a result of this. And in terms of who was receipt of the care, in most cases, we find that it was people caring for their spouses. So moving on to loneliness, and this is an area I'm particularly interested in. So I could talk about this for the entire hour, but I'll try to keep to time and guide you towards the report instead, where you can see the detail. And we also have previous reports we've published in this area. But similar to other studies, in TILDA we use a measure called the UCLA Loneliness Scale. And essentially this uses 4 questions to try and give us a more nuanced measure of loneliness. And you can see that when asked directly if people feel lonely, 37% said they do at least some of the time. And when asked if they feel isolated, 41% say that they often do. And this is double the percentage that we would have seen before the pandemic. So the kind of isolation people are feeling is having a really strong effect on their sense of loneliness. So this graph here essentially shows us the distribution of loneliness scores among adults. So the score on the left-hand side is 0, or those that aren't lonely at all, and it goes up to a maximum score of 10, which would be the most lonely. And you can see this is from 2018, and you can see from the shape of this distribution that, you know, an awful lot of people have don't feel lonely at all, and the numbers reporting loneliness kind of decrease with the degree of loneliness. Now though, if we put that beside the same measure collected during the pandemic, we can see that there's been a clear shift to the right. And this means that across the population, on average, the experience of loneliness has increased. And this increase is largely driven by the social isolation that people are experiencing due to being not able to see their friends and families or participate socially as much as they would have previously. And our colleague Georgia is going to show you just how big the changes people have made to their social lives in terms of their interactions with friends and with family and other social outlets. So before moving on, I also want to bring people's attention to the fact that loneliness has real repercussions for people's lives. So these graphs here show the average loneliness scores by their self-rated health and self-rated mental health, and have also split it by whether people live alone or not alone. So what we find is that people who live alone have significantly worse self-rated physical health and significantly worse self-rated mental health as well. And we've also shown in TILDA that social isolation is associated with premature mortality among this same cohort. So I think this is a really important issue that we need to be both wary of now, and also to find ways to try and address this as we hopefully come out, well, both now and as we come out of the pandemic. So I hope this has given you a good overview of the study and some of the content. As I said earlier, I'd encourage you to go download the report and the other reports that are available and have a look through the detail yourselves. Obviously, we don't have a scope to go through every detail of it in the time we have today. Also to say, for those of you who may be interested, and Professor Kenny touched on this earlier, the data used for this report will be made publicly available. So any researchers today, you will be able to access the data through the Irish Social Science Data Archive, and that will happen within the next few months. We also have a series of brief, shorter reports on specific topics using this data. So uptake of vitamin D, the effect of cocooning or shielding at home for the over 70s and so on. And also, as touched on earlier, as part of our questionnaire, we included 2 free text options. So to give people the opportunity to put in their own words their experiences. And there's some really rich and powerful narratives that have come out from that, and we're currently preparing a qualitative report that will tell people's stories in their own words. So I'm going to join you again at the end of this session, but for now, I'm going to hand you over to our colleague and co-author, Georgia Lawler from the Department of Health. Thank you.
Thanks, Mark. Firstly, I want to thank Minister Fian for his time and for supporting the launch of this report. As we all know, the COVID-19 pandemic has brought about profound changes to our daily lives and has particularly affected older people. Preventative measures such as social distancing to mitigate against the spread of the virus has meant it's no longer possible for people to do many of the activities they used to do. So in addition, healthcare appointments are being delayed or postponed due to the pandemic, which may have long-term negative consequences. So I'm going to be focusing on these topics today. So in the first part of this presentation, I'm going to discuss some of the changes that older people have had to make in their lives, including their adherence to guidelines on hygiene practices and social distancing. I'll also look at the different news sources that older people use for information on COVID and what their level of trust in these news sources are. So as you can see, there's a high level of compliance with government guidance on COVID. A large majority of people are engaging in protective behaviors to prevent the spread of the virus. So nearly everyone wash their hands more frequently, use special hand sanitizer. People are more conscious of covering coughs and sneezes, and just under 3/4 of people wear a protective face mask when outside among other people. So as well as this, older people are highly compliant with social distancing guidelines. This bar chart shows the percentage of men and women adhering to social distancing guidelines. So the chart on the left hand side represents men and women aged 60 to 69, and on the right hand side representing older adults aged 70 and over. So as you can see from the graph, women are more likely than men in both age groups always to comply with social distancing guidelines. What this means for older people and their friends and family is a complete change to their everyday lives. So to capture information on the extent of changes adults aged over 60 have made, we asked how often they did a range of activities since the outbreak of COVID. And as the table shows, the majority of older people have stopped attending religious services, are not volunteering, are not traveling to visit family or friends at all, and are not leaving their homes or doing grocery shopping as often as before. So this indicates that the pandemic has dramatically changed the social behaviours of older people in Ireland. We also wanted to know what information sources people are using to get information on COVID and what their level of trust is in these information sources. So as you can see from the chart again on the left-hand side, most older people get up-to-date news on COVID from Irish television and national radio, while 2/5 get their news from Irish newspapers and other television stations. And then social media, including Facebook, Twitter and WhatsApp, as well as government and HSE websites, are used by fewer older adults than other media. And then moving to the right-hand side graph, the most trusted sources are Irish television. And while fewer people use HSE and government websites to obtain information on COVID, they are rated as the second and fourth most trusted sources of information by participants. So social media websites are the least trusted sources of information on COVID. So this information is particularly important as we begin the rollout of vaccinations. So then just to summarize this section, it's clear that the pandemic has significantly changed the social behavior of adults age 60 and over. And while adherence to public health measures is high, it is critical that public health messaging continues to reach as many people as possible in order for people to maintain the changes they require to reduce the spread and exposure to COVID. So it's also important that trusted media are used in the communication of guidelines like these. So as shown, levels of trust in information and media sources varies greatly, with higher trust found in traditional media sources such as national television, and by contrast, very little trust in newer media such as Facebook. So again, just to reiterate, this information takes on even greater importance as we begin the rollout of vaccinations. The next section looks at the impact of COVID on the healthcare utilisation of older people in Ireland and the level of unmet need within this population. So we already know that there are disparities in access to healthcare among older people, and that unmet care needs are associated with negative health outcomes. And then the withdrawal of healthcare services due to COVID, in which many older people rely on, may make these issues worse. So looking at the types of medical care people delayed healthcare has been widely reported during the pandemic. And as shown in the graph, dental care is the most common healthcare service that older people are delaying or postponing. This result is unsurprising given that dental care practices were closed at the beginning of the pandemic. This is followed by delaying or postponing a GP appointment and an appointment with an optician. And about 10% delay or postpone getting minor surgery. So not being able to get an appointment is the primary reason given by 57% for delaying dental care. And among those who delayed GP care, being afraid to go to the appointment is the primary reason given by 53%. So then overall, looking at delays in medical care, nearly 1/3 of older people are delaying medical care. And we found that women and adults with a higher level of education were more likely to delay getting some form of medical care. So older people are delaying or postponing appointments because they think the appointment can wait, but appointments are also being cancelled or rescheduled, and people are also finding it difficult to even get an appointment, or they are afraid of going to their appointment due to COVID. So as a result of this, there has been a shift in how healthcare services are delivered, with attention now focused on new modes of care that avoid face-to-face contact, such as telephone and online consultations or virtual consultations. So this bar chart on the left shows the percentage of people aged 60 to 69, living in both urban and rural locations who use online and telephone GP services. And the chart on the right-hand side shows the percentage for adults aged 70 and over. So overall, almost half, 46%, of older people are availing of a telephone or online appointment with the GP. And as shown in the chart, older people living in urban locations are more likely than those living rurally to use virtual GP services. This is the same for both age groups. There is a higher proportion of adults aged 70 and over accessing virtual GP consultations compared to those under 70. And this is a finding that is consistent with patterns observed in the use of face-to-face GP services, and might simply reflect a greater need among the over 70s. And then finally, we examined changes in the use of health supplements among older people. Recent studies have shown a link between vitamin D deficiency and the severity of COVID symptoms. And they suggest that vitamin D has a role to play in the prevention of COVID, as well as the severity of the response to COVID. So this is of considerable importance given the prevalence of vitamin D deficiency in the older population. So in the current study, almost 1 in 7 older adults began taking vitamin D supplements since March 2020. And this is in addition to the 9% of TILDA participants who took supplements before the COVID-19 pandemic. And the bar chart here shows the percentage of men and women aged 60 to 69 and age 70 and over who have started taking vitamin D since the outbreak of the pandemic. So while there was no difference in terms of age, women in both age groups were more likely than men to have started taking vitamin D supplements. So in summary, these findings provide really valuable information on the use of healthcare services in the older population during COVID. It shows the effect of the pandemic on the delivery of services and the challenges faced by older adults in accessing these services. As well as this, the findings provide an important baseline for identifying and evaluating the long-term impact of COVID-19 on health outcomes, which may be of particular importance for older people with pre-existing conditions. So that is the end of my presentation. Thanks everyone for listening. And now I'll pass you on to Celine, who will be presenting next.
Thank you, Georgia. I'm going to share my screen now. Okay. So good afternoon, and thank you all for attending today. So I will focus in this talk on physical activity and well-being during the COVID-19 pandemic. I'm Celine, and I'm a researcher in TILDA. And this study was carried out in collaboration with my colleague, Killian McDowell in TILDA too. Promoting mental health in old age is becoming a major societal concern. And so we've heard it a lot, and we felt it too. The pandemic had a huge impact on our daily life. So we may expect, and there's been a bit of evidence now on that, mental health problems may have increased, being augmented with the COVID-19 pandemic. There has been a lot of emphasis placed in cocooning as part of the COVID-19 containment strategies. And so these may also have an impact on participation in physical activity and sedentary behavior in older adults. So we may expect that they have reduced the amount of physical activity and be more engaged in sedentary behavior. Being physically active is fundamental to maintain a good physical and mental health. It can protect us from cardiovascular diseases, cancer, diabetes, reduce mortality risk, as well as help us maintain good mental health. So, for example, Killian MacDonald in previous waves of TILDAs has shown that individuals that were physically active were less likely to develop mental issues such as anxiety and depression. So what we learned from the international data, from other studies, for example, in the US, is that changes in physical activity and sedentary behavior indeed can be seen in this population. So with a lower level of physical activity and higher level of sedentary behavior. And these studies also shown that there is a relationship and has an impact on a wide range of poor mental health outcomes. So we may expect something similar in the Irish context. In this study, we examined physical activity and sedentary behavior in older adults in Ireland, in TILDA participants who completed the COVID questionnaire. We also examined their mental health, so life satisfaction, stress, anxiety, and depression. And we also investigated the relationship between physical activity and mental health in this group. So we used the data extracted from the COVID-19 questionnaire. So we asked participants to report changes in physical activities, such as exercising at home, walking for more than 20 minutes outside, gardening, or watching TV. And we also asked them to report the amount of walking, moderate and vigorous activities as per the International Physical Activity Questionnaire. And to assess their mental health, we measured life satisfaction, stress, anxiety, and depression using well-established scale. So for example, for life satisfaction, we asked them to report how satisfied they were with their life on a scale between 1 to 10. We used the perceived stress scale to assess how they felt during the COVID-19 pandemic. And the generalized anxiety disorder screener, which has 7 items and which assess how anxious, tense, worried an individual was for the past 7 days. And we also use the Center for Epidemiologic Studies Depression Scale, which has 8 items and which assess how much an individual experiences a wide range of depressive symptoms. So this is what we found. So in terms of perceived changes in specific physical activities, so if we look first at the first graph here, what we see is that the amount of exercise at home and walking have remained the same for the majority of people. The same amount of participants report as exercising at home more often and less often, and the same tendency for walking, where we have an equal amount of people who reported doing more walking and other less often walking. The majority of people report that they did home DIY and gardening more often. Now, if we look at the second graph here, which is more specific on sedentary behaviors, we can see there's an increase of participants that report watching TV and reading more often. So there is an increase of sedentary behavior during the beginning of the pandemic. Now, if we look at physical activity using the IPAC questionnaire, so if we focus first on those green bars there on the graph, so these are the level of physical activity during the pandemic. So what we can see is that 42% of people were in the moderate category, which means they were minimally active. Then after about 20%, 30% in the high category and 26% in the low category. If we compare with So if we compare to wave 5, we can see there is a slight increase in physical activity. However, it's only 1/3 of participants that are engaged in health enhancing physical activity, and about a quarter did not meet minimum recommended levels of physical activity. So now if we look specifically at which individuals were more likely to be in the low category group, so having minimum levels of recommended levels of activity, we see that women are more likely to be in this group, individuals with a primary level of education or none, as well as individuals who live alone and those who live in urban areas. They're also less likely to be in this kind of the high activity level groups. Now, with regard to mental health, what we found is that life satisfaction was on average moderate, but we still see 37% of participants that report low levels of life satisfaction. With regard to perceived stress, it was moderate too, with 29% of participants who reported high levels of stress. And if we compare with wave 5, so the previous wave of TILDA, we can see there's been an increase in the amount of stress levels during the pandemic. Now, if we look at the anxiety level, they are on average low, but we still have about 11% of participants with moderate to severe anxiety levels. And finally, depressive symptoms. So they were on average 5.3 during the pandemic. And to put that in context, so if we looked previously at wave 5, so we can see there's a substantial increase in depressive symptoms during the pandemic. They went from 3.2 on average to 5.3 during the pandemic. And this means that 21%, so almost a quarter of the older adults in Ireland, present clinically significant depressive symptoms. And compared to only 8% pre-COVID. So it is a substantial increase here. Now, if we look at which participants are more likely to report lowest level of life satisfaction, we can see that the least satisfied are those aged 60-69, so they are less likely here in blue to be in the most satisfied category. Same with individuals with third or higher level of education, they are less likely here in green to be in the most satisfied category. And individuals who live in urban areas are also in blue here, are also more likely to be least satisfied with their life. Now, if we looked at which participants is more likely to report higher levels of stress, anxiety, and depression, we can see that these are women, individuals with primary level of education or none, and those who live alone. And these graphs here are specific to depression, but we found a similar tendency for stress and anxiety. So as you can see here, women in green, their tendency to be more depressed. Same with individuals with the primary education here, they fall into that category, more likely to fall in that category. And same again with those living alone. And we found also for depression specifically that those living in urban areas are also more likely to be depressed. As I mentioned earlier too, we also investigated the relationship between physical activity and mental health. And so what we can see here from those who do not meet the minimum recommended levels of physical activity, so they are represented in blue here across all the graphs. So we can see that those people that are in the low group here, they tended to be least satisfied. They tended to have higher levels of anxiety, higher level of stress, and tended to fall more into this depressed category. So to summarize, so despite a slight increase of physical activity during the pandemic, there's still a quarter of older adults in Ireland that do not meet the minimum recommended levels of physical activity. And this is particularly true for women, individuals aged 70 and older, and individuals with primary level of education. We also found that almost a quarter of adults, older adults in Ireland, report potentially clinically meaningful levels of depressive symptoms. This is almost a double of the prevalence compared to before the pandemic. And the higher prevalence of depressive symptoms are, those groups are women, individuals with primary level of education, those living alone, and those living in urban areas. So public health should really particularly pay attention to these groups and support them. We also found that those that did not meet the minimum recommended levels of physical activity, so those in the low category group, were more likely to report low level of life satisfaction, and also more likely to report higher levels of stress, anxiety, and depression. So promoting participation in physical activity specifically for this group may help boost physical and mental health, and especially in the longer term. So to conclude, efforts to control the spread of the virus, as well as maintaining and promoting mental health, need to be strengthened as a matter of urgency. Thank you.
Thank you very much, Celine, and thank you, Mark and Georgia, for your presentations. I would particularly like to thank the Minister Frank Feehan, who took time out today to launch this report. I would refer the audience, and we had almost 230 people at one stage, so thank you for attending. I refer you to the website for the full report, and give you a due warning that there will be another report forthcoming very shortly with respect to the free text responses that we received during this study. In other words, the voice of the Irish people who are over 60 with respect to their experience of what COVID has been like. We've heard about mental and physical health, well-being, physical activity, health service utilization, loneliness during the earlier stages of the pandemic up to November. I think it's pretty well accepted that this latter wave has had a more dramatic effect on all of us, and it will be very interesting for us to now explore the further impact of this latter wave in order to prepare for post-COVID, which will come. We have a vaccination and there is a brighter future ahead, but we need to be prepared for the knock-on effect of this past 12 months on Ireland, on our health and our society. So I thank you all and wish you well. Thank you.